Resume. Now you all are being recorded. All right. So thank you all for coming to Amy Martin's virtual lunch and learn about critical thinking and data validation, how identifying small errors can have big impacts. I'm going to run through a little housekeeping slide and then do Amy's introduction and then hand the reins over to her. So again, thank you for joining this. I know it's been crazy busy for us, so I'm assuming that it's been crazy busy for everybody else. So we really appreciate you taking the time to join us and learn about data validation. Everyone has been muted for the event. Please hold all of your questions until the end of the presentation. Raise your hand or turn on your video and unmute yourself to ask questions or send questions in the chat. We'll keep it pretty informal so we can kind of just jump on, and if you have any questions, we'll proctor through. Some of our upcoming SWEP events, definitely go to the website there and check out for more details. But we have the I-95 Archaeological Center tour scheduled for Wednesday, October 15th from 4:30 to 6 p.m. That's actually back by popular demand. Everybody said that was a great one. So hopefully you get a chance. That one does only have a registration limit of 20 people. So if that's something of interest to you, definitely jump on it ASAP. Our next event that we have coming up after that is Where Are They Now? Conversations with past awardees. That's on Wednesday, October 29th from 5:30 to 7 p.m. That's going to be held at Lewis Environmental in Royersford again. That one I think is going to be really cool because we have a presenter who's going to be doing a live raptor tour for that. So if that's something of interest, or not tour, sorry, live raptor presentation. If that's something of interest to you, definitely sign up for that. And then last but not least, our 30th anniversary celebration at the Touchstones is scheduled for Thursday, November 6th, 2025. And I just realized I forgot to put those times in there. So I apologize for that. But if you go to the website, it'll have all that information for you. And then we're just going to keep grinding away. We're trying to do some more additional events, such as virtual lunch and learns and in-person lunch and learns. And we're also trying to get more social and technical networking events scheduled for the rest of the year. As always, we are asking for volunteers. We can't express how much it helps with somebody just volunteering a little bit. So please be on the lookout for additional volunteer opportunities. As of now, we have committee volunteers, which is about an hour, and then event volunteers, which could be a couple hours for the event. So if you would like more information or how you can help volunteer, please go to info@swepweb.com and contact us or any of the board members. And with that, I will get or stop sharing. There's the stop share. And I will get into the introduction here. So, oh my goodness, too many screens. I'm sorry, guys. All righty. So, Amy Martin, as probably most of you know, is a SWEP member, obviously. So, but here is a little additional information that you may not have known about Amy. Ms. Martin has over 20 years of diverse environmental laboratory and quality assurance experience. As an associate chemist, she performs senior level review of data validation reports and project management duties for several projects of varying size and scope. She has performed verification and validation of organic, inorganic, and radiological analytical data to determine environmental data quality and usability, and prepared final reports. Data reviewed were for samples analyzed according to 40 CFR Part 136, drinking water RCRA, CERCLA, SARA requirements, and US DoD and DOE protocols using national, regional, and state validation guidelines. She evaluated laboratory data deliverables for compliance with regulatory and client-specific requirements. Ms. Martin audits organic, inorganic, and radiological laboratory facilities to evaluate compliance with T&I standards, laboratory standard operating procedures, good laboratory practice, and client-specific requirements. She prepares data validation SOPs, performs internal systems audits, and assists with the development of internal quality systems and internal training programs to teach data validation procedures. She is knowledgeable in the preparation of quality assurance project plans, or QAPs, and the preparation of analytical requests for proposals, RFPs. In addition, she is responsible for mentoring quality assurance chemists, including orientation, training on analytical methods, company SOPs and protocols, and validation procedures. Prior to this position, Ms. Martin worked as a quality assurance specialist and chemist for a major environmental laboratory in Georgia. She was responsible for managing performance evaluation, or PE studies, and accreditations, maintaining training records, and performing data method audits and internal quality system audits. In addition, she has analyzed and evaluated samples using Dionex ion chromatography, Waters, HPLC, and Agilent GC-FID and GC-ECD instruments for various clients. Ms. Martin is certified environmental analytical chemist through the National Registry of Certified Chemists. In addition, she completed OSHA 40 CFR 265.16 hazardous waste management training, and OSHA 40 CFR 172.702 and 172.704 hazardous materials management DOT training. Ms. Martin is a mentoress member of the board of directors for the Society of Women Environmental Professionals, Greater Philadelphia. She is a member of the American Chemical Society, Philadelphia local chapter and national chapter, New Jersey Society of Women Environmental Professionals, and AOAC International. And Ms. Martin received a Bachelor's of Science degree in chemistry from Georgia Southern University in 1999, and is in the process of obtaining her Master's of Science degree in chemistry from Ohio University. So without further ado, I turn it to you.
Sorry, y'all, I did not know he had the super long one. I would have abbreviated that if I had known. I'm only turning on the camera long enough to say hi, and I'll turn it back on during Q&A because it will end up bogging down my system if I leave it on the whole time. Critical thinking and data validation, how identifying small errors can have big impacts. As Dwight said, this was a presentation for the DoD, DOE quality conference this year. So there's several times I'm going to mention DoD and DOE. I apologize for that, but I didn't rewrite it just for this presentation. So the entire premise of this is rooted in an exercise that we actually performed at the 2023 DoD DOE workshop. And the topic was qualification based on a QC sample. They wanted to fire their validator. Most groups agreed that the validator followed the SOPs exactly as written, so they were not wrong in what they did. There were several of us, though, that questioned, should you have followed those SOPs exactly as written? Could there have been additional questions asked instead of putting on blinders and qualifying the results? I'm going to throw a gigantic disclaimer out there that this is not meant to indicate that all data are bad or that everyone is bad at their jobs. It just always sounds like that when you get into these presentations. I just want everyone to think about different ways that data can be impacted. Most of the examples in here are non-DoD projects, and any identification information of the client or the laboratory has been completely removed. So if you are a laboratory and something sounds familiar, please don't rat yourself out by saying, oh, we did that. Don't, that's something better kept to yourself. So have you ever thought the data is validated, it's fine, the site never has any issues, why do I need to look further? My laboratory is accredited, it's all okay. The field team collects samples all the time. Why do I need to look at anything? That's why they have receipt forms. If there was an issue, it would have been listed there and on the case narrative. Labs tell me everything that went wrong in the case narrative. Someone would notify me if there was a problem. My historical data lines up. Well, the results are kind of what we wanted them to be. Samples are never switched. It's never the field's fault. It's never the lab's fault. The field never does anything wrong. It has to be the laboratory or vice versa is where I was going there in case that didn't come across. We have a QAP. Why are we still having problems? A lot of these could be considered wishful thinking instead of critical thinking. We had a project once where PCB samples were sent to 2 laboratories. The results were vastly different. When we started investigating it, they found out that the laboratories interpreted the DQOs differently. One laboratory only reported the primary PCB for the site, and the other laboratory reported all PCBs present in the sample. Obviously, these are as error cores, not congeners. Having the DQOs clearly defined in a QAP or other specification document will make a huge difference, especially when you're trying to compare across laboratories. Data validation is a very important part of understanding the quality of your data. What most people don't realize is that it should never start at the point you have reported laboratory analytical data in hand. The higher the level of validation and the greater percentage of data validated, the better you will understand the quality of your data. You should always validate a percentage of data at the beginning of a project as stage 4. Then you're aware of any larger data issues that would not be seen in a lower level of data evaluation. Data validation is usually only thought of as reviewing the analytical data from the laboratory. There's lots of guidance written around this type of validation. But really, if you think about it, validation should be performed on all the data associated with the samples. It might have a different name. You might call it supervisor review, peer review, you're reviewing your field notes, but it is still an essential part of evaluating data quality. So as I said, it doesn't start with the laboratory analytical data. You need to start from the time you start thinking about the project. And as you gather data, that data should be validated. You have to have some sort of professional judgment in there, though, and you have to have sanity checks. It can't just be a checklist. It can't just be, did we get these items and we're checking a box. The documents out there are all guidance. If we're not doing CLP, contract laboratory program samples, the National Functional Guidelines can only be loosely applied. You have to interpret them because that's not the method you're analyzing for. That's a prescriptive method. You're validating data that was not run by a prescriptive method. Things are different. DoD has guidelines out there. They are written for RCRA methods for SW 846, but they're also written for DoD QC guidelines. Unless you're validating DoD data, again, you have to interpret it. The DoD guidelines do at least throw in that professional judgment is required. It is necessary. As my years in the industry have progressed, I've seen more automation developed to make things faster and cheaper. The triangle points out an important lesson about the results of automation, but let's not focus on that part. Let's focus on the part of automation removing a lot of your professional judgment. And unfortunately, evaluating data cannot be black and white due to the inherent variabilities between laboratories. No matter how much you try to control this with documents and QAPs, SAPs, which most labs don't even see the SAPs, but all these different documents that you're trying to say, this is what you must do, you'll never capture everything. And your general data validation guidelines developed by DoD do acknowledge that. Most of the others do not necessarily acknowledge that. So sample collection. What are some things that you could validate during sample collection? Well, you can review your field documentation. Are your sampling locations correct? Do you have sufficient field QC? Are you using custody seals? Are they only on the bottles or are they also on the coolers? Are the custody seals legitimate custody seals that if you peel it off, you can tell it's been peeled off, or it breaks when you open a cooler? Do you have proper COC relinquishment? Are your field EDDs correct? Are you using field EDDs? Are there project-specific sampling SOPs? Were they followed by all of the samplers? Is the sampling team consistent? What type of training exists for the field team? Has the field team been audited against the FSP, field sampling plan? Were samples collected at the proper locations? We kind of already hit on that one. Did you do split samples? Were the split samples done by different samplers? Did they collect samples using the same procedure at the same time? If the sample results don't match, looking back at the sampling procedures is just as important as reviewing the laboratory procedures. When and how are samples labeled? Due to recognizing the importance field QC can play in the evaluation of samples, we saved a client significant money on resampling fees. During validation, we could tell based on the results of the various field QC samples that a sample switch had occurred. When the laboratory investigated, they found that the sampler had written the sample IDs on the cap. When questioning the field team, it was found that one collector would mark the caps, then go back after all the samples were collected and fill in the labels. While doing this, vials were incorrectly labeled and caps were used to relabel the samples, along with re-extracting everything with additional volume. Luckily, they didn't have to go out and resample, but without that extra QC, we would have never seen the switch, and POET systems would have been maintenanced and additional sampling events would have been instituted. So POET systems are point of entry treatment systems. The stories I could tell about field blanks. We could spend an entire day here just talking about field blanks, I think. The field crew runs out of water for whatever reason. What do? Logical answer would be to contact the laboratory for additional water. But when you're in a panic situation, how often does logic actually prevail? I mean, let's be honest. Instead, we have seen store-bought water, which might have worked if they'd bought distilled water, but regular bottled water typically has minerals added back into it. So if you're doing any mineral tests, well, here come the detections. A temperature blank used to fill a field blank bottle. Do you know how often they reuse temperature blanks? There is no telling how many shipments or what type of samples that temperature blank had been exposed to, or even what type of water was used to fill it. That's probably the worst idea you can have. And this year we had what appeared to be basic water, that new wonderful trend where, oh, if I make my body basic, it'll be better for me. That water used in place of laboratory water for blanks. Critical thinking is most important when investigating these issues and determining if the field samples should be evaluated against the blank. Your average validator, or more importantly, your electronic data validation system, is just going to apply qualification and not look further to note that the detections and associated qualifications just don't make sense for the site conditions. When your field blank has a pH higher than every single sample on your site, and the pH of a field blank should usually be, we'll say at the low end, 5 to 7-ish, and it's coming out at 10, you have to stop and question if that makes sense. Is the documentation detailed? Do you have sufficient documentation to recreate the entire sampling event? Field notes are accurate and complete. Sample COC records are accurate. Site-specific field QC was collected at the appropriate frequency and the correct QC samples. Your QC samples are only as good as the collection team if it's a field QC sample. Do you have variances noted? Was your decontamination performed properly? Did they store the samples collected properly prior to shipment on ice with a trip blank in the cooler if it's necessary? I could go on and on with items that you could look at during sample collection and field review, but any piece of that is data that in the large scheme of things is important to review. Even something that you would think is as simple as homogenization, making sure that that was done correctly should be evaluated. Sample analysis. Did the laboratory use the correct and appropriate methods? Are you checking that before you get your data? Is the data properly narrated? Have they talked about all the problems, everything they qualified? Are you aware of whether or not they make method modifications? Have you asked them, are they running the method as written or if they've modified it? 10 to 1, there's modifications to any method that a laboratory is running. They might not be significant, but there's modifications. Are their calculations correct? Did they provide you with the correct deliverables? Does the lab always report the same compounds? Or do you have varying compound lists? And do you check those prior to them reporting the data with a sample confirmation form? We get sample confirmation forms for all of our projects. And that's a very valuable tool to look at ahead of time to make sure that what you get in the end is correct, that if something's logged in wrong or you're missing an analyte, you can have that fixed before you miss holding times or having to have it reported way later with qualification because they didn't know they were looking for it. Just like the field has problems with homogenization, the lab also has a difficult time homogenizing samples. The struggle comes down to the fact that organic and inorganic SW846 preparation methods handle standing water completely differently. One mixes it in while the other pours it off. Well, which should they do? What gives you the better data? How does it need handled? What did the field do? Homogenization on soils is a very difficult topic. Were samples subcontracted? Did they notify you that they were subcontracting them? Is the new laboratory running the same method? Is that specific method required for you, or is it just that analyte you care about? I was working on a project with hexachrome and a handful of other parameters. For years, the laboratory had run the samples with no problem. The laboratory network had just acquired a brand new laboratory in the general area. And with no notification, the samples were shipped to the new laboratory. They didn't consider it subcontracting because the samples were still within the same network. So as long as the samples stayed in a network lab, this laboratory didn't see it as a subcontract, so there was no reason to notify us. The problem came to light when we started validating the data. The original laboratory provided a level 4 data package and an Equus EDD. The subcontract laboratory report was included in the level 4 data package, but the laboratory only provided a level 1 report. And for those that don't know what a level 1 report is, it's just sample results. There is no QC. You don't get method blanks, LCSs. All you can really look at was, were they logged in right and did they need a holding time? There is nothing else you can really look at for that. Not for hexachrome anyway. Level 4 data package, you get everything. When questioned, we asked, why can't we get a level 4 report? We need the whole entire thing in the EDD so that we can validate this data. Well, the laboratory isn't able to produce a higher level of data package. They can't produce an EDD. Unfortunately for this project, hexachrome was the driving force. So not having the ability to evaluate anything beyond holding time was not really ideal for determining if the data was valid. This led to resampling fees and having data package requirements and other expectations in a QAP, or having that conversation with the laboratory upfront of this is what I must have, and ensuring that that the laboratory has a copy of the QAP could prevent some of these issues. Are your problems actually documented in your case narrative or associated results flagged? The opposite's also important. If they either need to be documented or flagged, preferably both. But in some way, you need to know that, all the problems are accounted for, and that's not often the case. You might have too much information and you might not have enough information. Does the laboratory perform a complete peer review of all data prior to release? How have they interpreted, or are they performing the data validation requirements in your QAP or your technical specification or the order that they're working under? What validation guidelines are they using? Did they base them on the NFGs? Did they base them on DoD? What modifications have they made? Are they marking where they've made professional judgment? Because your QAP can say all day long that a lab has to validate data. And this part is from the DoD, because DoD used to require them to validate the data as well. There's no guidelines around what they have to look at. So for their second level or their peer review, there's nothing written that says this is what you must do, unless you write that into your QAP and give them a copy. If soils were analyzed, were all the results corrected for percent solids? Were solids analyzed using an appropriate process? Working on a project recently, we had soil samples submitted by 2 different consultants to the same laboratory. Instead of treating samples based on who the end client was, that person who's actually paying the bills, the laboratory treated them based on which consultant submitted them. So one consultant never requests percent solids reported for their soil samples, and the other always requests percent solids reported for their soils and the samples to be reported on a dry weight basis. Data could have been reissued with an associated fee because wet weight reporting because the lab that had done dry weight could just back that out. But if you actually needed dry weight, there was no way possible to get that for all of this data. And it was only discovered once the data from both consultants made it into the ultimate client's database, and they were looking at the data as a whole. So being aware of how samples are going to be reported and being very clear with laboratories on what you need your data to be is important. Complete deliverables, that just sounds like that should be understood. But what constitutes a complete deliverable? There is no document out there that specifies this is what's required for a level 1. This is what's required for a level 2. Stage 2A validation requires what lab typically calls a level 2 report. Stage 2B validation, you could get away with what a lab calls a level 3 report because it's just summary forms. But once you start getting into stage 4, what a laboratory calls a complete data package can vary greatly from laboratory to laboratory. I've gotten data packages before where GC mass spec data didn't include any spectra. So you couldn't evaluate it to see if it actually was qualitatively correct because spectra weren't part of their level 4 package. That said, then you have to know going into it, this is what I need. And you have to make it very clear to the laboratory what you're looking for. Just saying, oh, I just need a level 4, or just give me your standard report. I needed to do stage 4 validation and their standard report was a level 1. So without having that clarity, then it just leads to lots of miscommunication and lots of frustration on everyone's part. If something was not received, then you have to also make the decision. Do you have the validator delay validation, while you wait for that information? Do they just write it up? Do they need to indicate what it could have impacted? What if it's a key piece of data that you have to have that would determine whether or not the data was actually usable? It's a decision that you're having to make if you do not make it clear up front what you need from the laboratory. We've seen data that was not properly reported because of standard errors. The esterification process wasn't accounted for in herbicides. Nitrate as nitrite was reported, but the standard was not corrected from nitrate. Nitrate as nitrogen was reported, but the standard wasn't corrected from nitrate. By writing up a missing deliverable, a major error like that could be missed. Although I would be remiss not to state that validation does not constitute review of 100% of every item that might impact a final concentration. Recalculations typically performed on 5 to 10% of the data, which means random evaluation of, let's say, 10% of the results. It could take time to find a problem, but you're more likely to find it than if you don't validate anything at all. So now we get into the examples. As I said, I've wiped out any identification of a client and any identification of a laboratory. This was meant to be interactive, but online it's really hard to do this interactive. So I will try to talk through it. But if anyone wants to just, shout out an answer, feel free, and we can turn it into interactive. So we've talked about things that can impact the data prior to what most people consider validation. But let's look at some examples of what we've found during actual laboratory data validation. This is a soil arsenic sample that was analyzed by ICP. All instrument QC met the acceptance criteria. For those that aren't as familiar with QC names, this is your laboratory control sample. This is your field sample result, matrix spike duplicate, laboratory duplicate, post-digestion spike, and a dilution test. So as you can see, the results are kind of all over the place. We have 101% for our LCS, 24% recovery for our MS, but 98% recovery for our MSD, which led to a very large relative percent difference. The relative percent difference on the laboratory duplicate was very high, but the percent recovery on the post-digestion spike was good, and the percent difference on the dilution test was very high. Since this was based on DoD, these are the guidelines that are in their SOP. So your MSMSD is less than 30%, you have to J+. You can remove your direction of bias if the PDS passes, but all your not detects get flagged X. For DoD, X may be rejected. They don't leave it up to the validator to make that decision. They leave it up to the end data user to make that decision. So depending on the decision of your end data user, X could be rejected. If your RPD is high, then you qualify to text and not to text. And if your dilution test fails, then you qualify to text. So with that in mind, given what was on the paper, you would end up having these options for qualification. Because this sample was a detect, it would get a J, but because the MS is considered very low, any not detects in this batch would be flagged X. So electronic validation, or your average validator who's just, these are the rules I was given, I have to follow them exactly as they're written. I call it rote validation. Your native sample would ultimately be qualified as J without a direction of bias. And, it's a J. It's okay. It's a J. But as I said, in organics, you qualify the whole batch usually, unless you know the sample matrices are very different. So any not detects in here would get an X, and then the end data user might decide that they're rejected. You would be completely within your right to leave this as is, and anything going through electronic DV would do just that. if you get someone looking at it with more of a critical mindset, they're going to go during their sanity check, they're going to be like, well, do these numbers, does this really make sense? Like, why would my duplicate be 4 if my MS is 40? Like, if my sample's 27 and my MS is 41, like these numbers are all over the place. What's going on here? And it's very clearly not specifically matrix or specifically preparation. So the LCS, the MSD, and the post-digestion spike prove preparation errors and matrix interference should not be an issue because they pass. 2 of those are on matrix. One of them is strictly on a clean matrix, so it would not be impacted by field matrix. The matrix spike, the laboratory duplicate, and the dilution test indicate matrix issues, but you have 2 other things that tell you there's not matrix issues. One item being unusually high could be explained by a hotspot. I mean, this was arsenic metals, but the MS is low, the dupe is extremely low, and the dilution test is extremely high. This made us kind of scratch our heads a little bit and go, something else is going on here, especially since the PDS and the dilution test came from the same native sample digest. That's not even, hey, we hit a hot spot, because that's the same extract and they came out completely different. So a question to the laboratory indicated that there might have been a sample QC switch, but they weren't really comfortable saying that, so they re-prepared all the samples. So in this side of the screen, I don't know if I can make it turn into a highlighter or not, but over here, we have their redigested results along with the recoveries. I don't know what I just did, sorry. Oh, I skipped forward a slide, that's okay. Along with their percent recoveries. There we go. And you can see that LCS still passes. Your native's pretty close to the same result. You have a good matrix spike, a good matrix spike duplicate. Yeah, the RPD is still a little high on the laboratory duplicate, but much better than it was. Your post-digestion spike is good. And the dilution test is a little high as well, but I mean, they have a limit of 10% for that. So now when we look at the qualification, the data is still qualified, but it's only qualified for the laboratory duplicate, and the not detected results would now be UJ, not X. So while you still have qualification, you're not having that debate of should this be rejected. You're more likely to actually be able to use the data. The laboratory also evaluated the initial and redigested results to determine which samples might have been involved in the sample switch and reported those from the redigestion, as well as ensuring that we had the best results we could. So it wasn't that they just, oh, look, we proved there was a switch, so this sample is now reported from here, but everything else is still reported from the original. They did actually redigest everything and reported based on comparison of the original to the re-extract. A similar example to this, we had a laboratory matrix spike duplicate RPD that was significantly greater than 20%. And there was a very large difference between the MS and MSD results. We couldn't evaluate recovery because the native sample was greater than 4 times the spike amount, but you could still evaluate the precision, because at that point, the spike amount's negligible. So you can compare actually the sample, the matrix spike and the matrix spike duplicate as triplicates and look at the relative standard error or standard difference. There was no evidence in the prep log or raw data that a prep or analysis issue had occurred. The spike duplicate, so the matrix spike duplicate, and PDS all met criteria. The matrix spike duplicate, sorry, serial dilution. That SD was a serial dilution. So spike, serial dilution, post-digestion spike, all met criteria, but the matrix spike duplicate was an outlier. And by looking at the parent, the matrix spike, all of this as triplicates, we finally determined that they must have had a hotspot for elemental lead in the sample they used to prepare the matrix spike duplicate. And that was where everything kind of fell apart, causing qualification all over the place. But because it was able to be evaluated with all of that QC to determine that there was a outlier, we chose to just address it in the report and not apply qualification. Again, if it had been an electronic system, it would have just qualified it and kept going, because they don't have that ability to look at it closer than that. But when you start seeing things that just don't make sense, which is what that sanity check means, you have to dig a little bit deeper and question it. So our second example is another metals example. But I don't want anyone to think, oh, metals are terrible, I should never have metals done. It's due to the fact that metals have so much more QC. Organics have problems too. It's just harder to find those examples when you start pulling things together, because they don't have near the number of QC samples that a metals batch has. So this example is from a set of soil data. Although the samples were soil, the laboratory presented the serial dilution in an on-instrument aqueous unit, and the J and U flags were added to the summary form by the LIMS, their laboratory information management system, based on the aqueous method detection limit that they had converted from the soil limits. So the package software calculates the percent difference for samples greater than 50 times the aqueous MDL. But it just doesn't look right. So the initial sample result is straight. The serial dilution result is 5x dilution, in case anyone's not aware of what a serial dilution is. Oops, why is it not advancing? Sorry. There we go. So we were looking at it going, well, if copper's 36 in a straight one, how is it less than the RL in the 5x dilution? And zinc's a detect, so why is it suddenly a not detect in a 5x dilution? We calculated the percent difference for the copper because it indicated that it was greater than 50 times the MDL, meaning that the lab calculated this value, which is saying that this is 50 times the MDL. Well, if this is 50 times the MDL, a 5x shouldn't make this less than the RL unless your MDL and your RL are massively different, which is possible. So we said, okay. But then we're looking at the zinc and it's like, well, you reported 142U in your serial dilution, but you have a J value in your initial sample as 71.1. Again, it's not, well, this one we're like, that's not even possible. If this, because it's MDL reporting. So if you have 142U, 142 divided by 5 is definitely less than 71.1. So how can this be a J and this be a not detect? And that's where things started to really not make sense and we started questioning them. So if 142 was the 5x serial dilution, 71.1 would have to be greater than the base MDL. It's still could be a J, I guess, but it just didn't make sense. And arsenic, we kind of ran into the same thing. If you divide this by 5, like, why isn't there a detect there? Something to evaluate. It just didn't make sense. So we decided to confirm what was actually presented. And we pulled in, here's the sample specific MDL, here's your serial dilution MDL. The sample result, the serial dilution result. And then they calculated that percent difference. At this point, we still weren't trying to look at raw data because this wasn't a level of validation that actually includes raw data review. The samples were dried prior to prep. For this project, they do dry the soil samples for metals before they prep them. So we know that the base soil and water MDLs are the same. There's no adjustment for percent solids or anything like that. The weights were almost one every single time, so it was very minimal difference. The initial sample result was not diluted. They compared these and the validator really started questioning themselves. All the results exceed the MDL, yet a lot of them say U, and except for cadmium, all the results in the initial sample were greater than 50 times the MDL. Like if you take zinc times 50, I'm sorry, not, yeah. The zinc's 1.4, so times 50, that's less than 71.1. So why is this flagged as a J value? And not actually calculating anything because it's more than 50 times the MDL. And as I said, unless you have very, very, very different MDLs and RLs, but the new procedure should bring those much closer together. You shouldn't have those being 100-fold different. So they dug a little bit deeper because at this point, there's enough questions here that even though it doesn't involve data review for this validation, we didn't feel right just flagging it and saying, here you go, client. We felt that we needed to figure out what was going on and ask the lab some questions. So pulling in the raw data results, which is the numbers in parentheses, we were able to figure out what the actual values were that they had flagged as U. Knowing data evaluated against the DoD QSM, the difference has to be 10% then, and this one was we were required to look at 10% for this. We were concerned because that meant we could have missed other qualification. Now the methods have different criteria depending on which version of the method you're using. And I think the current NFGs are 20%. So if you're doing 20%, you didn't miss anything. You're good. It just wasn't presented right. You were missing a lot of information, but everything passed. But if you're doing something lower, like 10%, because you're still stuck on some old limits from a QAP that's been in existence forever, then you missed some qualification, unfortunately. So we looked at the project data, recalculated everything, and then once we had an idea of what was going on, we asked the laboratory to look into it because we couldn't figure out what had happened on their end that caused it to do this. All we knew was that it wasn't calculating the way they said their form calculated. They discovered that the 20x dilution that was performed on all field and QC samples had been removed from the QC sample calculations performed in LIMS, including calculation of the MDL for the serial dilution way back in 2021. This was 2024. So we have 3 years where the calculation had been changed. The laboratory was looked into it further, and because they had removed the dilution factor in the conversion of the MDL from milligram per kilogram to microgram per liter, the MDL results they were using were 20 times higher than the actual value. So where this is the MDL we were using, their system had this times 20 to do the 50x evaluation and then calculate the percent difference. The validation of the change was not comprehensive enough to find this error when they made the change, which meant they had to go back and review more than 2 years worth of soil data to determine the impact of the mistake. We ended up with additional qualification on this report, but overall we had minimal impacts on our samples because the results are usually so high that that 20-fold dilution wasn't going to matter. But that might not be the case for other clients that had soils run over that 2-year period. So they were having to contact people to let them know what happened, and they had to fix their system and update their validation procedures for when they implement a change. So other examples, I guess I want to leave time for questions. Sorry. So I'm trying to be cognizant of that. I won't run through all of these. I'll just hit on one of them. But you could have problems with qualitative evaluation, calculations. We've seen problems with radium results, cross contamination. Calculation errors we've run into several times, including anything from not adjusting results for the sample preparation factors, incorrect standard concentration corrections, incorrect methanol corrections for the methanol soils for VOCs. Those have included wrong formula, correcting for methanol and not percent solids, correcting for percent solids and not methanol. We've seen calibrations with intercepts that exceed the MDL. So a response of 0 will actually give you a detection. Sorry, I'm trying to decide which example I'd like to share. We'll go rad because I don't get to talk about rad nearly often enough. So radium is one of the radiological results that is often reported as radium 228, radium 226, and radium 226 plus 228. There are several different methods for radium 226, some of which measure it directly, and others that test for a different isotope and convert the results. These issues should be common knowledge, but what is more difficult is how each lab reports the sum. Because RAD reports negative values, if the values are used as reported, you could end up with a total that is lower than one of your components. Most labs will use the value as calculated unless you request something different. In addition, there's large debate over how to handle the minimum detectable activity or minimum detectable concentration, usually reported as an MDL in your EDDs, and the uncertainty for the sum. Some labs use the lowest, some labs use the highest. I've seen at least one that added the values together. We like to see the square root of the sum of the squares used. And when we talk to labs, they'll go, oh yeah, that would be best. But no one tells us to do that. But all these differences, if you're getting radium 226 plus 228, mean that the data from different labs, even within the same network, can be reported completely differently for your project. So it's really important to think about what you need to be evaluating and define these types of things in your QAP and make sure the laboratory gets your QAP so that what you get in the end is what you actually needed. And if anyone wants to talk about my other examples at some point, catch me at whatever SWEP event I managed to make it to this year. Y'all keep having them when I'm out of town, and we could talk about this all night. So in conclusion, sometimes you just have to be a fish that swims upstream and not the one that goes with the flow. I did really have a difficult time narrowing down the list of examples to fit into this presentation because it had to be 45 minutes. But as I said, if you ever want to talk about the fun things your data can tell you, let me know. Questions?
Must be Tuesday.
I was beginning to think my mic broke halfway through or something.
We got a message. Oh, you're welcome, James. No questions for Amy? I mean, you did put a lot of detail in it, so.
I can always talk about my last two examples, or everyone can have 5 minutes back.
Anybody have a preference? Do they want to hear her other examples? I'm taking silence as
They
people
want
would
their
want.
5 minutes back. I can't
Yep.
blame them.
Well, thank you, Amy, for that very detailed and in-depth data validation presentation. Definitely, I mean, being in the data validation world myself, um, getting to hear those things definitely resonates with me because then, I have an idea of what to look out for, the projects that I work on. So thank you.
Mhm.
Well, I guess with that, if nobody has any questions, no want to hear the final examples, we're going to give you back your 5 minutes. And I hope you guys enjoy the rest of your week. And again, thank you, Amy, for doing this.
You're welcome. Thank you for letting me present.
Of course. All right. Have a good one, everyone.